Welcome back. 38 minutes after the hour. Have you seen this video? Take a look at that. Those containers falling off of that ship. They fell off a cargo ship and tumbled into the Pacific at California's port of Long Beach. Police are still investigating what actually caused at least 67 containers to fall off the ship Tuesday morning. There were no injuries reported, but that could have serious implications for shipping in the U.S. as 1/4 of all containers move through West Coast ports, and they all come through Long Beach. Port officials are calling this an accident. And the CDC director fired after serving only 29 days is being called to testify before Congress next week. One GOP senator is calling for Susan Monterez to go before the Senate Health, Education, Labor, and Pensions Committee. This comes on the heels of Health and Human Services Secretary Robert F. Kennedy Jr. getting grilled last week on why he fired her. And sandwiched between all of that is Secretary Kennedy's major MAHA announcement. More than 100 initiatives targeting vaccines, chronic disease, and childhood nutrition. Joining me now is founder and chair at the Healthcare for Action and board-certified vascular surgeon, Dr. Anahita Dua. Dr. Dua, I have to ask you this. Secretary Kennedy's 20-page, 128 initiative agenda is a tall order under normal circumstances. Is it even feasible to be able to accomplish all of this? And what would be the timeline?
That's a great question. Thank you very much for bringing me on to discuss. Basically, to begin with, it is a tall order, but that's what we should expect of our government. So that in and of itself is not the problem. The issue is more, I can list off 500 things that I'd like to do today right now, but the most important thing you're going to say to me is, okay, how are you going to do it? And previously in February, when initially we had this order saying that by September, we are going to get a list of items that the government is going to focus on, we were promised that we were going to see some of how that executive function was going to occur. And unfortunately, in this particular report, while there are some wonderful things within it, there's nothing in it to explain how it would actually happen.
Dr. Dua, Secretary Kennedy identified 4 drivers behind the rise in chronic disease in children, including poor diet, chemical exposure, and lack of physical activity, and over-medication. What's the best way to tackle these issues?
Well, it depends. First of all, you have to break it down and say, are they actually issues? And while it may seem immediately like they are, it has to be in context of what we're trying to do, which is make children healthy again. So number one, we have to say, well, what are the top 10 reasons why children are unhealthy? And how do these things actually work together in a nonlinear fashion? For example, it's very easy for me to say a child needs to eat properly. They should have good, nutritious meals. Well, what are you going to do about the social determinants of health that allow them to actually purchase that food, eat that food? What are you going to do about them having time to do physical activity if they can't make it to school? So it all has to be taken together. And that in and of itself is a tall order. But if you have all these ideas without any plan, you really have nothing.
It's one of those things. I remember a friend of mine talking about how, Nick, you have to recognize that every child does not have access to a balanced meal each morning before they start school. And sometimes school is the only time that they get that meal. Dr. Dua, that further complicates things. Mr. Kennedy testified that America is sick. And many argue 2 things can be true at the same time. America can be sick, but removing vaccines isn't necessarily the best move either. I do want to talk to you about vaccines. The Secretary wants to change the vaccine framework, meaning changing the vaccine schedule and the list of vaccinations that children could receive at specific ages. How concerned are you that changing the vaccine framework could put kids at risk for certain diseases?
Oh, 100% concerned. I don't think that this is even a question. This is a fact. There are certain vaccines that have been around for almost 100 years, and we have significant proportions of data that show that children indeed survive. In fact, just almost 100 years ago, 1 in 5 children would not make it to the age of 5, and it was fundamentally vaccines that allowed that change to take place. And now, of course, we see our kids grow up. No one is debating what RFK is saying, that children are sicker in this country. It is true that nowadays, basically, a child born in America may not live as long as their parents live. This is all true, but it's not the vaccines. That is a fact. So we need to focus on what it is and genuinely make America healthy again. You cannot have a conversation about children becoming healthy without talking about gun control, which is the #1 cause of child death in this country today. So in conclusion, if you're going to have a commission like this, you're going to put effort and money into something like this, it cannot be contradictory. You cannot say children need to get food and then simultaneously cut SNAP benefits and cut Medicaid. Again, there are many people in this country, many smart people that would help RFK get to the goals that he wants. But with that over-skepticism of things like vaccine and distractions on things that, health influencers have really pushed in and not science, we're going to have bigger problems than we currently have.
Dr. Anahita Dua, thank you so much for joining us this morning.
Thank you so much for having me.
Culture